And
Yeah.
so I did a session last week with a young adult male who's the patient in question and his parents. And, his parents are good people, well-meaning people, and their son, who definitely has a serious substance use disorder, tends to resort to passive aggression to get like a rise out of his parents, right? As a lot of young adult addicts will do, like to just get
Hmm.
a reaction. And so uh, what I was able to do last week when I sat with them was I was able to convince, essentially through just like highlighting a discrepancy between like a stated goal, like that's a very motivational interviewing thing to do,
Yeah.
right? Is you highlight discrepancies. But I highlighted a discrepancy between like his stated goal of being respected more by his parents and like them trusting him, which everyone in my treatment center was shooting for from their family, and his behavior being passive aggressive to get a reaction. And so I just highlighted that discrepancy, and I asked a very simple open-ended question, which is, why does this choice you made make sense to you? It wasn't aggressive. It wasn't passive aggressive. I didn't have like an attitude or a tone. I was just very like curious, essentially,
Yeah.
which is part of like the MI mentality. Um, like, why did this choice to say it this way? Why did that matter to you? Right. And he said very clearly that he feels very unimportant and that they don't trust him. And so I understood, right? Given the behavior, given all the ruptures in the family because of the addiction, etc. Of course. So I normalized. And I encouraged him to restate what he wanted and restate his feeling in a less passive aggressive way. And he got the reaction he actually wanted from his parents, as opposed to the gotcha moment he had by being passive aggressive, you know.
Yeah.
And I've got dozens of those kinds of stories doing family therapy, because for the most part I work with young adults who are kind of like there because they have to be there.